Hello everyone, how are you? I wish you all a very happy dentist's day. So with this, we will start with today's topic, the mandible. So the first point is, mandible is the largest and the strongest bone of the face. Second point is, it is derived from the first pharyngeal arch. Okay. First is the largest and strongest bone of the face. Second is, it is derived from the first pharyngeal arch. Third point, actually this third point should be the first point. It is derived from word mandibula. Okay. It is derived from the word mandibula. Mandibula means jawbone. Okay. So this will be your introduction. The word mandible is derived from mandibula, which means the jawbone. It is the largest and the strongest bone of the face or the facial skeleton. And third point is, it is derived from the first pharyngeal arch. Now coming to the structure. The human mandible is divided into two surfaces. One is the outer surface and the other is the inner surface. The various anatomical features or landmarks will be described by dividing it into two parts. One is the landmarks on the outer surface and the other is the landmarks on the inner surface. But before starting with the anatomical landmarks of the mandible, let's understand few basic terminologies that we will use frequently while describing this topic and other upcoming topics of anatomy. This is for the students who have started reading anatomy now. The students who know these can skip this portion. So there are few terms, that is, one is superior, the other is inferior, medial, and the other one is lateral. And there are two more terms, one is anterior and posterior. These 6 terms are very important. Okay. जिनको ये पार्ट समझ में आती है, it's well and good. जिनको नहीं आती है उनके लिए, the other people can skip this part. So superior means something which is above the subject of study. For example, I am the subject of study, right? So something which is above me is called as superior. Okay, जो ऊपर है. So in normal layman's term, what we say? This is above me. In anatomical language, we say this is superior to me. Okay. Something which is below me is called as inferior. Okay. Something which is above is called superior. Something which is below me is called as inferior. Anterior and posterior. Again, I am the subject of study. Suppose I am standing like this. So something which is in front of me is called as anterior. Okay. And something which is behind me is called as posterior. Okay, so I hope these 4 terms are clear. Superior, inferior, anterior, posterior. Right? Now there are 2 more terms. One is medial and the other is lateral. So what is medial and what is lateral? Medial is something which is placed towards the midline or near the midline. Suppose this is the midline. This is the midline of my body. Okay. So something which is closer to the midline is called as medial, and something which is away from the midline is called as lateral. Okay. Now shifting to the main topic, that is the landmarks on the mandible. So if you can see this diagram, okay, before coming to landmarks, the basic structural parts of the mandible. Okay. So this portion, okay, this portion is something horseshoe shaped. I will show you a structure, 3D model of mandible, if you can see. So this is a 3D model of mandible, right? Okay. So this shape you can see, it is horseshoe shaped. Okay. So this portion is called the body of mandible, right? This portion is called the body of mandible. This is the outer surface. This one is the inner surface, and this is the body of mandible. Okay. Now, the upward projected portions, these two, this one and this one, they are called as the ramus of mandible. Okay. And the portion where body and ramus meets, this portion, okay, this portion, this is the angle of mandible. So this is the body of mandible, this is the ramus of mandible, and this portion is the angle of mandible. Okay, this is the basic structure. This region, the superior border of the body of mandible, this is superior border, matlab the border which is above. Okay, the superior border of the mandible is called the alveolar crest or alveolar ridge, which houses all the teeth, the lower teeth. Okay, the mandibular teeth set, right? Now coming to the landmarks. So we will study the landmarks divided into two parts. If you can see, this is the landmarks on the outer surface and these are the landmarks on the inner surface, right? So let's talk about the landmarks on the outer surface. First is the symphysis menti, second is the incisive fossa, third is the mental protuberance, fourth is the mental foramen, and fifth is the oblique line. So coming to symphysis menti. Symphysis menti is a faint ridge-like elevation, okay, present on the anterior aspect of the body of mandible. So this one, this orange marked line which represents a ridge-like elevation is the symphysis menti. This is the region, or this indicates the fusion of left and right halves of the mandibular bone, right? Symphysis menti is a faint ridge-like elevation which indicates the symphysis means joining, okay, joining of the left and right halves of the mandible. Okay. Next is the incisive fossa. Fossa means a shallow depression. Okay. So incisive fossa is something, a shallow depression present below the incisor teeth, right? A shallow depression which is present below the incisor teeth. Third is the mental protuberance. So mental protuberance is a triangular elevated area, this one, okay, a triangular elevated area which is present on the anterior-inferior aspect or anterior aspect of the body of mandible. Okay, so mental protuberance is a triangular elevated region found in the anterior aspect of mandible. Next is the mental tubercles. Mental tubercles are two more anterior-inferior elevations found on the anterior-inferior angles of the mental protuberance. इसको हम अलग से एक बार दिखाते तो आपको अच्छे से और समझ में आएगा. So, if we see the mandible from the anterior aspect, it looks like this something, right? So this is the central incisors, the lateral incisors. So there is this line, this is called as symphysis menti. Okay, this depression is called as the incisive fossa. A triangular elevated region here is called the mental protuberance, and the inferolateral angles of the mental protuberance are called as the mental tubercles, right? This is the symphysis menti, this is the incisive fossa, this is the mental protuberance, these are the mental tubercles. Okay. Next is the mental foramen. So mental foramen is a foramen. Foramen means opening, okay, through which nerves, blood vessels pass. So mental foramen is a foramen which is present below the junction of the premolar teeth, okay, the interproximal area of the premolar teeth. Okay, so this is mental foramen. Mental foramen is of a very important, mental foramen has a very important clinical significance, that is the position of the mental foramen changes according to the age. So if we want to study the age changes in mandible, then location of mental foramen is very important, right? Next is the oblique line. So what is oblique line? Oblique line is the continuation of the anterior border of the ramus of mandible. This is the ramus, right? So ramus of mandible का जो ये anterior border है, sharp anterior border का continuation downwards and forwards into the body of the mandible. Okay, so this is the body of the mandible, this is the ramus of the mandible. So continuation of the anterior border of the ramus of mandible into the body of mandible, this is something called as oblique line, right? तो यहाँ तक आपको clear है? These are the 5 landmarks on the outer surface. Next, moving to the landmarks on the inner surface. The first is the mylohyoid line. Okay, so mylohyoid line is a groove, sharp groove that is present on the inner surface of mandible that runs obliquely downwards and forwards. Okay, so this line which runs obliquely, if this one is the ramus, if we see in the lateral aspect, so mylohyoid line runs obliquely downwards and forwards below the third molar teeth. Okay, so mylohyoid line runs obliquely downwards and forwards below the third molar teeth. Okay, next is the mandibular foramen and canal. So mandibular foramen is a foramen which is present, mandibular foramen is present just a little above the center of the ramus. Okay, just a little above the center of the ramus. So these are the mandibular foramen. If you can see, this is from the inner aspect of mandible. Okay, or you can see here also, this is the mandibular foramen. So mandibular foramen is present slightly above the center of the ramus at the level of the occlusal surfaces of teeth. This is the occlusal surface. Okay, this is the occlusal surface. So occlusal surface के level में ही है और थोड़ा सा ऊपर है, slightly above the center of the ramus, mandibular foramen. So mandibular foramen leads to a canal which is called as mandibular canal. This one, this white one is the mandibular canal. If you can see in the inferior aspect also, this is the mandibular foramen and this is the mandibular canal. Okay, so mandibular canal also runs downwards obliquely and it opens into the mental foramen. It goes from inside and opens into the mental foramen. Okay, so 2 points you have studied. First is the mylohyoid line and third is the mandibular foramen and second is the mandibular foramen and canal. Okay, third is the lingula. So lingula is a tongue-shaped projection which is present just anterior to the mandibular foramen. So this is the mandibular foramen. So this one is the lingula. Okay, this is the mandibular foramen on the inferior aspect. This is the lingula. So lingula is a tongue-shaped projection present on the anterior aspect of mandibular foramen. Okay, टंग शेप प्रोजेक्शन है जो कि मैंडिबुलर फोरामेन के जस्ट सामने है. ओके, द हेड ऑफ द लिंगुला इज डायरेक्टेड टुवर्ड्स द condylar process. Okay, the head of the lingula is directed towards the condylar process. I'll show these 3 landmarks once. See, so this is the mandible, inner surface of the mandible. If you can see here, there is there is a small opening. If you can see, or if you have models with you, you can check your models also. There is a small opening here. This is the mandibular foramen. And there is a small tongue-shaped projection just anterior to the mandibular foramen, which is called as the lingula. And the head of the lingula is directed towards the condylar process. Okay. Mylohyoid line is something which is running downwards, obliquely, forwards, and below the third molar teeth. This is the third molar. Below the third molar teeth, this groove is called as the mylohyoid line. Okay. Mylohyoid line mandibular foramen and the mandibular canal, and this is the lingula. Okay, now there are three fossa. Okay, coming to the mylohyoid groove. Mylohyoid groove is present just below the mandibular canal. Mylohyoid groove is a groove which is present just below the mandibular canal. It also runs downwards and forwards towards the body of the mandible, and it vanishes or merges in the submandibular fossa. Okay. Next is the genial tubercles. So genial tubercles are something. There are two paired elevations on the inferior aspect. Genial tubercles are two paired elevations. These are the genial tubercles behind the symphysis menti. मतलब symphysis menti सामने था, ठीक है, outer surface पे, just उसके अंदर surface पे 4 elevations are there. They are called as genial tubercles. They are present in two pairs. First is the superior genial tubercles. Next is the inferior genial tubercles. Okay. There is a fossa here, oval shaped fossa. The fossa should be oval shaped. This fossa is called as digastric fossa. Okay. Now, if you remember, you have studied in your class 11-12 basics that there are three pairs of salivary glands, parotid, submandibular and sublingual. So submandibular and sublingual gland is positioned somewhere in the inner surface of the mandible, where we will see that. So this mylohyoid line, there are paired fossas. So if we draw this here, this is suppose this is the mylohyoid line. Okay, okay. So there is a depression or fossa above the mylohyoid line, which is called as the sublingual fossa, and which houses the sublingual salivary gland. And below the mylohyoid line there is another fossa which is called as the submandibular fossa, and which houses the submandibular salivary gland, right? This one is the coronoid process. The posterior process is the condylar process. Now coronoid process, the name is derived from crow's beak. Okay, it resembles the beak of a crow. Okay, this is the coronoid process. And condylar process is derived from the word because it resembles knuckle shape. Okay, knuckle shape means ये मुट्ठी के shape, correct? So coronoid process, crow's beak, condylar process is knuckle shaped, right? So coming to the condylar process, the space between the coronoid and the condylar process, this border, this portion is known as sigmoid notch. Okay, this is called as sigmoid notch, also called as mandibular notch. Okay, mandibular notch or sigmoid notch. Now condylar process, this upper portion of the condylar process is called as head. Okay, now the constricted portion, मतलब ये पतला वाला जो portion है, this is called as neck, right? Head of the condylar process, neck of the condylar process. Now head of the condylar process is very important because it articulates with the temporal bone. Okay, it articulates with the temporal bones with the help of lot of cartilages, fibrocartilages and everything. So it articulates with the temporal bone to form, what it will form? Temporo from temporal, okay, mandibular from mandible. Okay, so it forms a joint named as temporomandibular joint or TMJ. Okay, so the significance of condylar process is it articulates with the temporal bone and forms the temporomandibular joint. The joint is very important for opening and closing of the mouth, right? Now this depression, the depression marked in orange, it is called as, I'll mark it here, it is called as pterygoid fovea. Okay, fovea means also depression. Okay, pterygoid fovea. Okay, this clears the coronoid and the condylar process. Now talking to the borders, the anterior border and the superior border is very thin. Okay, while the posterior border is thick. Okay, posterior border is continuous with the base of the mandible through the angle of the mandible, right? Because this is the posterior border, it is thick and it is continuous with the base of the mandible through the angle of the mandible. So this finishes the landmarks of the mandible. In the next video, we'll talk about the muscles, attachments of the mandible and the nerve supply and etc. of the mandible, along with the age changes in mandible. If you have any doubts, feel free to ask in the comment section. Leave a like, comment, share the video. Thank you.